The Birmingham Hip Resurfacing implant is not brand new. It has been in use around the world since 1997 and has since been implanted more than 65,000 times. The benefits to patients of the Birmingham Hip Resurfacing technique and implant are clear. The implant's head size, its bearing surfaces, and its bone-sparing technique make it a preferred choice for young, active patients. While the implant's rate of survivorship is comparable to standard total hip replacements after 5 years, these three key advantages set the resurfacing technique and implant apart from its total hip replacement counterparts. The most noticeable aspect of this implant is its size. While it closely matches the size of your natural femoral head, it is substantially larger than the femoral head of the total hip replacement. This increased size translates to greater stability in your new joint, and it decreases the chance of dislocation of your implant after surgery. Dislocation is a leading cause of implant failure in total hip replacement. While total hip implants dislocate at a rate of 1 to 3% over the lifetime of the implant, a study of 2,385 Birmingham hip resurfacing patients found that dislocation occurred in only 0.3% of cases 5 years after surgery. Birmingham Hip Resurfacing takes advantage of one of the orthopedic medical industry's most technologically advanced bearing surfaces. That means that the surfaces of the ball and the socket are made from materials that dramatically reduce joint wear when compared to traditional hip implant materials. In this case, both the ball and socket are made from tough, smooth cobalt chrome metal. Traditionally, only the ball is made from cobalt chrome, and the socket is lined with a plastic cup. While this plastic cup has some design advantages, it does wear out over the course of many years since it rubs against the metal ball at a rate of nearly 2 million footsteps per year in physically active adults. When both surfaces of a hip implant are made from cobalt chrome, wear particles are reduced by 97%, thus potentially extending the life of the implant. There may be risks associated with metal-on-metal hip implants, though. While no evidence has been established on the subject, some are concerned that the increased level of metal ions found in the blood of metal-on-metal hip recipients may have negative effects on the human body. For this reason, some surgeons may not implant such a device in a patient with kidney disease or in women who are or may become pregnant. Perhaps the greatest benefit of the Birmingham Hip Resurfacing implant is the fact that it conserves more bone than a total hip replacement. This is important for two key reasons. First, unlike a total hip replacement, the Birmingham Hip Resurfacing technique preserves your natural femoral neck. It is this neck length and angle that determines the natural length of your leg. And since it is not removed and replaced with an artificial device during a resurfacing procedure, concerns regarding leg length discrepancy are greatly reduced. Second, if your surgeon should determine you need to have your Birmingham hip implant replaced at some point in the future, you may undergo a regular total hip replacement surgery. If you had originally undergone total hip replacement instead of hip resurfacing, you would be dealing with a more traumatic and complex procedure, and you would be receiving a more invasive implant. As you may know, total hip replacement requires the removal of the femoral head and the insertion of a hip stem down the shaft of the femur. Hip resurfacing, on the other hand, preserves the femoral head and the femoral neck. During the procedure, your surgeon will only remove a few centimeters of bone around the femoral head, shaping it to fit tightly inside the Birmingham Hip Resurfacing implant. Your surgeon will also prepare the acetabulum for the metal cup that will form the socket portion of the ball and socket joint. While the resurfacing component slides over the top of the femoral head like a tooth cap, the acetabular component is pressed into place much like a total hip replacement component would be. The femoral head is then dislocated from the hip socket, and the surgeon begins resurfacing the joint. First, the cartilage of the acetabulum is removed using a special reamer that forms a hemispherical shape. The remaining void will allow for a proper fit of the metal shell. A provisional or trial component is placed in the reamed area to determine the proper size and fit. Once your surgeon is satisfied with the size and positioning of the trials, he will implant the metal shell. The next step involves the resurfacing of the femoral head. Special instruments, such as the McMinn Alignment Guide, named for one of the technique's creators, British surgeon Derek McMinn, are used to precisely trim just a few centimeters of bone around the femoral head. It is shaped to fit tightly inside the Birmingham Hip Resurfacing implant. Once satisfied with the resurfacing of the femoral head, a special type of acrylic bone cement, which is well tolerated by the body, is poured into the femoral component to facilitate its snug, stable fit. After the implant is in place, the femoral head is inserted back into the acetabulum. Who is a candidate for the Birmingham Hip Resurfacing system? The typical patient will be physically active, under 60 years of age, and suffering from hip arthritis, hip dysplasia, or avascular necrosis of the hip. The implant can be used in patients over 60 whose bone quality is strong enough to support the implant. Your surgeon will make the determination if you are a candidate for hip resurfacing. How long will the Birmingham Hip Resurfacing implant last? It is impossible to say how long your implant will last because so many factors play into the lifespan of an implant. In the case of resurfacing, for instance, the metal-on-metal bearing surfaces of your new joint may extend its life longer than that of a traditional total hip replacement. How is the Birmingham Hip Resurfacing system different from regular total hip replacement? Hip resurfacing conserves more bone than a total hip replacement. In total hip replacement, a moderate amount of bone is cut away to make room for the implants. Birmingham Hip Resurfacing requires just a few centimeters of bone to be resurfaced in order to accommodate the implants. Side by side, it is obvious that the Birmingham Hip Resurfacing technique conserves more bone than traditional hip replacement surgery.